Hi, I'm Dan Pollybea. I'm a professor of medicine at the University of Colorado in the Department of Medicine and in the Division of Hematology. The next abstract to share is one that I was involved with, and this gives an update on long-term outcomes for patients who received Venetoclax plus an HMA in the first-line setting, and then went on to receive an allogeneic stem cell transplant. So there were two different studies that were evaluated to find such patients. And ultimately, there were 33 patients from these two different studies that we identified and followed. So again, patients who received a venetoclax-based upfront regimen went into some degree of response and then had an allogeneic stem cell transplant. So, not everybody considers eligibility for a transplant for these patients because at the outset they were not eligible for induction chemotherapy, but that's a mistake in our opinion that we're trying to address or correct. You can be a transplant candidate once in remission and not have been an induction chemotherapy candidate. And this data really supports that. We had very good long-term overall survival. So median overall survival was around 30 months for those patients who went on to receive a transplant. Overall outcomes in terms of toxicity were not reported specifically in this study, but this was felt by the investigators to be a pretty positive outcome for patients, again, who typically don't have a curative therapy available to them.